Good morning, good afternoon, and good evening to our webinar participants from around the globe. Welcome to this DevEx webinar sponsored by Research for Community Access Partnership, or RECAP. This is a 6-year program that supports research into low-volume rural roads and transport services in Africa and Asia, funded by a grant from the UK government through the Department for International Development. RECAP aims to strengthen the evidence base on more cost-effective and reliable low-volume road and transport services, thereby influencing policy and practice. It works on a portfolio of research, capacity building, and knowledge management initiatives in partnership with new and existing national research centres and local partners. Today's webinar is entitled Research to Practice, Engaging Local Communities in the Future of Transportation. My name is Helen Morgan, Editorial Associate at DevEx, and I'll be your moderator today. Today's webinar topic is an important one. We're going to talk about how we can better engage local communities in rural road and transport research. There's an increasing need to conduct research around rural roads and transport services in Africa and Asia to learn more about how we integrate the perspectives, attitudes, and knowledge of the people affected by transportation plans. Research about the planning, construction, and maintenance of rural roads and transport services really must incorporate the opinions, knowledge, skills, and perspectives of local populations to support suitable and sustainable solutions. To discuss this important matter in more detail, we're joined today by 3 outstanding panelists who have extensive experience in the road and transport sector. After their presentations, we'll have plenty of time for our speakers to answer your questions. Our lineup of speakers today is as follows. Tony Greening, Independent Transport Research Consultant with TRL. Gina Porter, Senior Research Fellow at Durham University. And Caroline Barber, Head of Programs at TransAid. We're delighted to be able to draw on their expertise during today's webinar. After the presentations, we'll allow plenty of time for Q&A, and so you'll be able to enter questions using the Questions tab or chat box in the ReadyTalk window. Feel free to submit questions at any time during this webinar. We'll be keeping track of your questions, and we'll try to get to as many as time allows. If you do have any technical problems during the webinar, please note that although I won't be able to deal with them myself, just send a message through the chat box, and one of my colleagues will assist you. During the webinar, we'll be live tweeting from @DevEx. Our Twitter hashtag for this and other DevEx webinars is #DevWebinar. So if you want to interact with others listening to this webinar, then just use this hashtag. Again, that's #DevWebinar. We'll be looking out for your tweets and retweeting them, so do join the conversation online. I'd now like to hand it over to our first speaker, Tony Greening, who will kick off our presentation. Tony, thanks for joining us. Perhaps I could begin by just asking you to give us an overview on the current state of rural road and transport research.
Thank you very much, Helen. Good morning, afternoon, and evening, ladies and gentlemen, wherever you are. My presentation this afternoon, is just to give a brief overview of what's happened in transport research in developing countries over the last 10, maybe 15 years or so. So maybe I'll begin by just reminding ourselves that there are still a number of problems that exist. And this slide was actually taken from a World Bank presentation a few years ago to remind ourselves that many problems still exist. And this is just a short few examples. 1.2 billion of the world's poor still lack access to an all-weather road. 40 to 60% of people in lower-income countries live more than 8 kilometers from a health care facility. And although that doesn't sound so much, this 8 kilometers can involve very difficult terrain, as in places like Ethiopia. And many people still live far, far greater distances from a health care facility. People in rural areas can walk 20 kilometers or more to an all-weather road. In terms of road safety, over 3,000 people die from road traffic injuries a day. 85% of these are in developing countries. and 90% of injuries occur in low and middle income countries. So over 70% of roads in Africa still remain unpaved. So research is required to provide cost-effective solutions to these and many similar problems in the transport sector that impact on rural communities. I need just a few pictorial examples of access in that they affect all road users. So you see that the point I wanted to make from those 4 brief pictures is that there are both social and economic impacts from poor access. And while economists might say to us, well, it doesn't really matter if a rural road is shut for the day, if you are, as in the first slide I showed there on those pictures, if you were the people with a young child who maybe got malaria, then being delayed access to a health centre for just a few hours can make a huge difference and can be really worrying. So what was the situation of research in lower income countries? And why do we need to do something about it? Well, in terms of local practitioners, these are the people who are most knowledgeable about local problems, and local communities too, of course. They are more than aware because they are the people who are impacted from poor access. But these are also the people who are best suited to find appropriate solutions. The situation, unfortunately, in the past in developing countries is that although many countries have been independent from colonial rule for more than 50 years, yet many still rely on expatriate inputs for research to find solutions to transport problems in rural communities. This situation is clearly not sustainable. The problem is that there are constraints on research and research knowledge. Research is seen as a luxury by many politicians. In the past, research reports were in hard copy and difficult to access, making updating them costly and infrequent. Designs and specifications for roads were based on traffic, materials and environment in developed countries, and although they were modified to some extent for developing countries, they were still very inappropriate. Roads are constructed, of course, to strict designs and specifications. Contractors and consultants adhere strictly to these designs and specifications because the consequences if something goes wrong when they've deviated from them can be very serious for them. Infrequent revision of design manuals constrain the implementation of beneficial research outcomes because of this infrequent updating and the reluctance for some consultants and contractors to adopt these measures. Then it led to serious constraints on the implementation of research. And just to remind ourselves why research is important, it's the mechanism for the advancement of knowledge and growth. It provides opportunities to test new ideas and to develop innovative solutions, which can very often make a huge difference to rural access. Countries that invested heavily in research have grown economically. That is, there is a relationship between research, investment and growth. And you've only got to look at some of the countries where in my youth, and I'm quite an elderly guy now, in my youth were very backward, very undeveloped. Some of these countries who have invested in research have made enormous progress in terms of their economic standpoint in the world. Developing countries' investment in research, including in the transport sector, is often zero. And this is very, very disappointing after such a long time. And just to give some examples of the potential benefits of research, TRL back in the mid-1990s was under pressure to actually show that there were some benefits for research. And the annual benefits of just 12 projects was 15 times the annual cost of all TRL projects, which at the time were over 400, being undertaken in the base year. And another paper given by Bly to the Institute of Civil Engineers in 1996 stated that the estimated road and development benefits in the UK were that for every £1 million invested, the benefits to society were £20 million annually. So there are significant benefits from investment in research. And what are the potential impacts of local research centres? This is why local research, I believe, is so essential. But of course, there's advancement of knowledge, as there always is from research. Develop of new ideas and innovative solutions, as I mentioned earlier. But perhaps far more importantly is they provide local solutions. There's also opportunities, many of which are being undertaken under the current RECAP program, is calibrating research-based evidence from elsewhere. That is learning from neighbouring countries where perhaps have invested in research, and then calibrating those outcomes to benefit the local population. And longer-term research projects tend to give the biggest benefits. And although research has been done in terms of projects, there has been no sustainable investment very often. And when projects come to an end, that's the end of that research, and there's no follow-up research. And it's the longer-term projects that often give the biggest benefits. And of course, if you invest in a research centre, there's a better chance for sustainable research. There always has been a problem with putting research into practice. There is an inevitable resistance to change. People do not like change. People are much more comfortable in existing procedures. There has been political apathy, there's no doubt. There's inappropriate focus on risk sometimes too. Engineers are naturally adverse to risk because the consequences can be serious if they get things wrong. There's a resistance to new technologies, always has been. And there is very little incentive for change. So what are the solutions? Well, perhaps greater consultation with all stakeholders. And I mean everybody involved, from the researcher, local researchers, right through to communities. So that people feel that research can help them. Ownership by stakeholders and perhaps greater involvement in the planning of research projects. Demonstration projects that show the potential benefits are very important and can be undertaken by research centres. And consultant and contractor training, perhaps, also because it's okay to have workshops, and it's important to have workshops and training courses and whatever, but actually what really gives the confidence for contractors and consultants to use the outcomes from research is to actually demonstrate that they actually are beneficial, and training on the problems that inevitably arise when they undertake new technologies. And lastly, design manuals. This is very, very important, because as I said earlier, roads are built according to very, very strict designs and specifications. So getting the research into design manuals is very, very important, and this is a major component of RECAP, and is likely to have a major impact in the implementation of past research outcomes. So there has been a change in approach to rural roads in recent years, which has helped research. There's a greater appreciation by politicians that the road network is an important national asset. The timely maintenance of these roads are really vital. Roads don't fail tomorrow if you don't maintain them today, but they fail, they will. Dedicated funds for maintenance have been set up by establishment of road funds. There's been a different approach to the life cycle costing of rural roads, which allows us to look at them in the same way as an investment in higher order roads. Many of the results of research has enabled us to upgrade roads from gravel to paved roads at lower traffic levels, a lower traffic threshold for upgrading. There's been the development of various forms of low-cost servicing technology, which allows us to give sealed roads at reduced cost. And all this is helping to help the provision of local transport services. If roads are better, transporters are also far more likely to provide the transport services which are so desperately needed for local communities. And far more importantly than all these, perhaps, is the increased acceptance of the need for developing a local research capacity. So things are changing, things are improving. So what have been some recent impacts? Well, UCAP government projects such as CCAP in Southeast Asia, AFCAP, the African Community Access Program, and RECAP now, which incorporates the second phase of AFCAP and a component for ASCAP, which is the Asian Community Access Program. Research and demonstration projects are taking place under these programs, which show local practitioners what can be done to benefit local communities. Design manuals and specifications are now in digitized form, which makes it much easier to upgrade to include the results of research and continually update these documents. Training and workshop in research and best practices also have been undertaken under RECAP. Increased consultation with local practitioners and communities is now taking place. And as I said before, reports in electronic format and internet access make all this knowledge that's being developed through research much more accessible. I just want to give a couple of examples to finish on the possible impacts of research. I was involved back in the 1980s, I think it was, on research that had been undertaken by TRL and funded by the British government in Botswana. And this is a before and after photographs of the Trans-Kalahari Highway. And the important thing about this particular project, I should acknowledge if Mike Bernard is listening that he provided me these photographs. The road before was the one on the left, and none of the materials available locally for the construction of that road met the existing specifications at the time. So research was carried out by the Roads Department in Botswana with the help from TRL to actually study the performance of some local materials, and from those results of that research, it was possible to use these materials. And the estimated savings producing the road shown on the right was around $20 million. Finally, I just want to show this slide because this is a road that was constructed quite recently in northern Ethiopia, in which 3 kilometers of road was constructed through a village. There was an existing gravel road which was extremely dusty, and in fact the houses on one side of the road, which were below road level, were at the end of the road of the dry season were completely covered in dust. And clearly there is an issue in terms of local pedestrians being exposed to the effects of dust, particularly children. And here you see, I don't know if you can see in the background, the children walking to school with the road safety officer in the front there who's actually conducting traffic. Traffic on this road is actually quite high. So the biggest benefit that the local people keep on telling us is that the amount of dust generated now is very, very little, of course, because the road is sealed. And this is using a low-cost seal, which was developed in Scandinavia called the Otter seal. And it enables us to use weaker aggregates, weaker stone, which is available locally. That's the point, it's available locally. And these are just a couple of examples of how research can bring down the cost and improve opportunities for improved access for local communities. Thank you very much.
Thank you, Tony, for that great overview. We'll go straight into our second presentation with Gina Porter now from Durham University. Gina, over to you.
Thanks, Helen, and good day, everybody. I'm going to talk about various research methodologies that can be used to bring communities really into the process of building new transport services in particular, but generally in improving transportation. So I'm going to focus on users, and particularly people who are really disadvantaged, women, children, older people, infirm people, very often have very little access to transport services, may have none at all. And I'm going to talk about 3 different methods, approaches to sort of engage with people in those communities. So participatory action research, where you actually make an intervention and then monitor what happens, mobile interviews, and finally co-investigation, where we can work with people as equal joint members in a research endeavour. So I start then with participatory action research. And this is a study I did some years ago with Ghana's Ministry of Agriculture. We worked in 5 off-road villages in coastal Ghana and wanted to try to find out whether intermediate means of transport might improve women's market access, but what other impacts that intervention would also have. So what we did was to start with a year of collecting data, observing how people in those villages accessed or weren't able to access transport, and in particular women. Then, with Ministry of Agriculture support, we took 6 different IMTs into each of those villages, and people were able to buy them on credit, on reasonable credit, but women were given first option. And then we had 2 research assistants sitting between these 5 villages for 20 months and looking at what those 70 adopters actually did with the transport, those IMTs, and how it impacted on their wider lives. But we also had a matched control group, so we could compare those adopters with people whose lives just continued as normal. And it was really interesting how much we learnt from this exercise, because often IMT is introduced, it fails, but people then just go away. By exploring through this very careful monitoring, we found out, for instance, that it was only families with children who could help operate the equipment. That's when they were happening. And that people, when we asked women beforehand what sort of equipment they'd like, they'd mention certain things, but when it came to buying the equipment, they went for something else. So that's participatory action research. And the key features then are the intervention experiment and then following through. And obviously the great advantage is that you can compare what people say they're going to do or what they might do if they had certain things with actual patterns of adoption and use. But the limitation is how long it takes and finding that suitably matched control group. So that's participatory action research. Another approach that I think is very useful in beginning to understand community access needs and transport needs are mobile interviews. We had a major study with children, looking at children's transport and mobility in Ghana, Malawi, and South Africa, 24 research sites, and we found that walking with children was really, really important in learning about their transport needs and experiences. Often they were very shy and they couldn't talk easily face-to-face with adult researchers. And of course there were always parents listening and so on. So if you went for a walk to the well or to school or whatever, you learnt a lot. So mobile interviews then of this sort can be used not just with children, but they can be used with other groups of people. They don't need to be just used as walking journeys. You can use them on if you're traveling with somebody. It's a good way of getting rapport with interviewees, particularly where the interviewee and the person interviewing are very different in terms of their power and their place in the world. You get a lot of insights into journey constraints and benefits, but again, it's the time and the cost of doing this kind of work, there may be ethical issues. You've got to be very careful if you're walking with children, for instance, or traveling with children, that you've got parental consents and so on, as well as the child's consent. And you know that if you have a male member walking with a female child, there may be issues around that sort of thing. Older people also may not easily walk long distances. Moving on then to the third method, which is the one I want to spend more time talking about. This is co-investigation, and using co-investigation as a base for then extensive academic research as a subsequent phase. We use this in that 24-site study with young people in Ghana, Malawi, South Africa. We recruited 70 young people as co-researchers. They were 11 to 19-year-old school children. We gave them a week's training workshop. We had 2 of these in each country. And the children selected what methods they were going to use, where they were going to do their research, the time scale, and so on. But then we used that information to help build the key questions for our checklist interviews, for the qualitative research which followed, and for a major survey. And then this is where we really built on what the key points that they had raised and key questions. So the point is then that when you've got commonly excluded groups like children, it's very difficult for them to start to express their views. Very often they're not expected to speak, and yet they do often have complex mobility needs. And if you use a co-research approach, then you will get a much clearer view of those needs and experiences. And it can be a very, very productive route into community understanding. We've used that subsequently. We've done another major study, same 24 research sites, but this time looking at the relationship between mobility, transport, and what mobile phones mean and how they connect. And that's been very, very useful. And here again, some of those child researchers we trained in 2006 who are still working with us because they see the importance of this work, and we really value their contribution. We've also used it in an ASCAP study of older people's mobility. And I'll say a little bit more about that, because here we only trained 12 older people, but we gave them a week's workshop, and we had support from HelpAge, who were also collaborators in this study. And again, it was extremely useful in understanding key issues for older people's mobility and access. This was in Tanzania. And the older people learned all sorts of simple techniques, and then they decided which ones they would use. We didn't use mobile interviews because they decided that those didn't really work. Older people working with older people trying to understand what's going on, because long journeys were hard work. But seasonal calendars, timelines, using disposable cameras, and so on. And just a few pictures here, and you can see people in the workshop practicing different approaches, learning about interview techniques, and so on. And then at the final workshop in Dar es Salaam, where our older people, our peer researchers, were actually able to talk about their evidence and even engage with the Minister for Health. So co-investigation it's this method where you're recruiting community members as co-researchers, and you learn from them so that you can then build a much larger study, which they may not be able to spend the time to do, but building then quantitative as well as qualitative research from their key questions. really you get unique community access, you get novel insights, and you can help to redress power imbalances. The issue is, again, time. The skill, the inputs you need for the initial training. There are ethical issues you've got to think very carefully about. In this case, you really do need intensive support throughout to your peer researchers and think about the interactions with other stakeholders. But finally, just to sort of wrap up more broadly on participatory research approaches and engaging communities, I think there are massive advantages to be gained, particularly when you're working with vulnerable groups. You get deeper participation, you do get stronger project ownership, and you do get good data quality. But you have to think about the time and the cost for the participants as well as the researchers. You've got to think about ethical issues. You do have to really understand the power, the politics, the culture, the history of the communities where you're working. And of course, even despite you can build all this knowledge, but transport professionals may still continue to exclude those voices, and you've got to think how much you are able to actually do. Outcomes are crucial. So will you be able to deal with any negative outcomes? Will you be able to ensure that community voices do really resonate through and reach the people they need to reach? And thinking just about our own biases as researchers always as well is very important. Thank you.
Thanks, Gina, for that very interesting presentation. I'd like to now turn it over to Caroline Barber from TransAid to give us a bit of your perspective as an implementer. So how does this type of research play itself out on the ground? Caroline, over to you.
Good afternoon, everybody. My name is Caroline Barber. I'm coming from an organisation called TransAid, and it's a pleasure to have the opportunity to share some experiences with you all today. And thanks very much to Gina and Tony for those really interesting presentations. So I would like to take a moment to share with you, as Helen introduced, some of the practitioner perspectives, I suppose. My presentation is entitled Implications of Community Participation in Road Projects. And I must say before I start that this presentation was actually intended to be delivered by TransAid Zambia project manager, Victor Simfukwe. Unfortunately, he was unable to be with us today, so we've prepared this presentation together, and it's a shame he can't be with us, but hopefully we'll share the key messages. So moving to my first slide, I wanted to start. I think this presentation builds nicely from the foundation, the background that Tony has given, and then the detail that Gina's gone into. For a community engagement approach, there are some key considerations that we need to bear in mind. First of all, programs that aim to improve access for people living in rural communities need to invest, and they need to take the time and create the space to understand the key issues on the ground. And as part of this, it's vital to understand the local context. And this really includes starting by looking at the current availability of transport services, and that's sort of TransAid's key consideration, really, and especially in a rural context. As Tony mentioned, the community themselves are really best placed to articulate what their transport needs are, and they may look very different to what an imposed perception of what those transport needs might be. We've also found it's really important to not only talk to communities and the users of transport, but traditional leaders as well, who can play a really critical role in opening up transport services if they're brought on board as part of the discussion. We find that communities can offer advice and feedback on what needs to be strengthened, what transport, for example, might be suitable for the terrain, what could be maintained locally, and very importantly, what is culturally appropriate. So in summary, without the involvement of the community, from a practitioner perspective, I do strongly believe that programs are likely to be unsuitable, unsustainable, and a high risk of failure if we neglect the actual users of the transport themselves. So what I would like to do is to take a case study, which is a program that we've been running for a couple of years now in Zambia, and we're just actually wrapping up at the moment. The program is called More Mamas, Mamas standing for Mobilizing Access Maternal Health Services in Zambia. And I think both the previous presenters both highlighted this issue that any delays, any barriers in access can have devastating consequences if, for example, as Tony mentioned, you're living far from a health facility, if the transport isn't available. And what do you do in an emergency situation? So that's really what we were focusing on in this program, which was responding to stubbornly high maternal mortality rates in rural Zambia, and looking at how we could bridge the referral gap. So we're really focusing on the community to the first level health centre, which was otherwise quite a neglected area of focus in the referral chain. So this photograph is showing a group of SMAGs, which stands for Safe Motherhood Action Groups, who are volunteers within the community taking charge of their own health, working through a community empowerment and community engagement approach. Sorry, just jumped the slide there. So the background to this program. Essentially, there are a number of barriers which were there to accessing health facilities. And in rural Zambia, transport is often expensive, it's often limited in availability. Terrain itself can be challenged. There's a photograph on the right here you can see on your slides, which is taken from Western Province, in Mongu, showing the deep sand. Currently, many women actually in labour walk, or they use makeshift stretchers, or they are pushed on a bicycle. And importantly, some women are actually discouraged from travelling at all to a health facility due to a lack of transport. So it might be unavailable, it might be expensive, or it might be such a perceived barrier or an actual barrier that women don't travel at all to a health facility. Okay, still in the context of Zambia, most people in rural Zambia living far from the health centres. Delays can worsen the clinical severity of cases, particularly where complications exist. And there's plenty of global evidence suggesting that implementing transport strategies alongside other interventions may contribute to a high percentage. A Murray and Pearson study in 2006 suggested an 80% reduction in maternal deaths. So what strategy did the More Mamas program take? It was really a partnership approach. The program is actually funded by Comic Relief, a UK donor, and it's implemented in a consortium of, which has a number of members. There are 2 international and 2 local partners in the consortium. So our local partners, a Zambian organisation called Disacare, who are a group entirely run by people with physical disabilities who construct mobility aids. We have a group called Development Data who are registered and running their operation in Zambia and Zimbabwe, and they're looking at the monitoring and evaluation aspects. We also have our partners, Health Partners International, and then of course there's TransAid. We work in partnership with the Ministry of Health and closely with our communities. Okay, I think it's jumped a slide there. Apologies for that. Okay, so the approach was a close collaboration with the district health management teams as part of the Ministry of Health and a comprehensive design work at the community level. And this is really, I think, what we're zoning in on here today, to make sure the time was spent at the start of the programme to understand the issues, to look at distance, to look at the terrain, to look at the socio-cultural and economic context, and speak to the communities about their perceptions of all of these, to talk about what type of transport might be appropriate, what accessibility there would be in rural areas for spare parts, etc. And these findings then informed the Emergency Transport Scheme, with the ETS as we called it, design, and ensured that the programme built on what was already in place and wasn't just picking up a solution from elsewhere and trying to impose it. So we used an approach of intermediate modes of transport to respond and to try and improve to rural communities' physical access to health facilities. So this involved 102 bicycle ambulances that were constructed locally, and 18 ox carts and 36 oxen, which were, the ox carts were also produced locally in the district of Mongu, and the oxen were also sourced, again, from within the communities as well. So just to show you a couple of photographs, this is the bicycle ambulance. So we have a robust bicycle made by World Bicycle Relief. They're also built within Zambia. And this is the trailer that pulls behind the bicycle as well. Now, of course, it's not the fastest means of transport, but what we were looking at here is talking to the communities, working where there was already an existing bicycle structure, where people were comfortable to ride bicycles, where they were comfortable with maintaining bicycles, and were able to work with this stretcher, with this trailer that would go on the back and pull behind to cover the distances. Again, we're talking about the first mile from the community level, where there may not be any transport at all, and certainly not available 24/7, which was another major barrier. In Western Province, bicycles were in many of the areas less suitable. There's deeper sand in many areas, and there's a high local preference for using ox carts. So what we've got a photograph here is 2 volunteer ETS, Emergency Transport Scheme, riders who are walking and leading out here with the ox cart. And this is actually a situation where there was a mother inside who's on her way to a health facility. And again, it may just challenge a little bit the perception of emergency transport. But if in areas where motorised vehicles cannot get through, or where simply motorised transport may not be available, where there may not be funds there for the fuel and the maintenance and those ongoing costs, this is something that can bridge the gap. And it's only really successful because of the community ownership of this means of transport, where the riders are there, where there's a system for accessing them, where people will move quickly, where women and their husbands know how to access the means of transport, where possible there's a communication system in place to call ahead to the health facility. So it's not just the physical hardware of putting the IMTs in place. It works because of the community engagement and buy-in to the process. And if we don't start by asking for people's suggestions of what would work, why it would work, what kind of ground clearance do we need, what modifications, if it's for emergency transport or if it's specific to an area, need to be made to work with local artisans, because we also don't want to be putting anybody out of business who are also working in these areas. So moving on to the next phase, just a little bit about how it works, just briefly. The program does come in to work with the community to deliver some training. We work closely with the district health management teams, mobilising communities. The ETS, the Emergency Transport Scheme riders, and the custodians who look after the transport of the vehicles are nominated by the community themselves. That is really important. That there is wider community engaged in the discussions about how to access the vehicles, community stewardship, who has the right to use the vehicles and when. It must be the community to set these rules and responsibilities. So that key message as well then, that the transport being managed by the community, it's also the maintenance, the safekeeping and the responsible usage is also community run and managed. We worked with existing structures instead of trying to impose new ones. So for example, neighbourhood health committees were involved in the process. They actually had loads of great suggestions about coming up with demonstration rides to introduce the emergency transport scheme to the community, because especially the bicycle ambulances, they're looking a little bit different. So to try and sensitise community, give people a chance to try them and get more familiar. And the DHMTs, the district health management teams, involved in them in all aspects as well. So the community themselves, but also the government support structures and Ministry of Health. So bringing them along for the initial needs assessment work and for the ongoing monitoring and the review activities. So the training, I'll just quickly move through this, but the rider training would include the role of an ETS volunteer, encouraging people to share stories, recording trips in logbooks, safe lifting and handling of pregnant women, patient confidentiality, basic principles of the ETS maintenance, physically how to dismantle and assemble, particularly the bicycle ambulances, safe lifting techniques, I've already mentioned that. Oxen being well cared for. There's quite a lot of complexities in that as well, making sure that they're vaccinated, screened, that they are procured locally to prevent diseases by bringing animals from other parts of the country. And then developing community action plans as well. And again, very much over to the community there for what were their suggestions, what did they want to see. So they came up with the ideas of general community meetings, the demonstration rides, and also the building of the shelters as well. which they took very seriously and is helping prolong the life of the IMTs as well. So moving to the next slide. So what were some of the results? Well, in terms of taking quite a participatory approach to this program, we actually saw that it also started to build community cohesion as well. I mean, on a practical level, we've got communities now who can access transport when they need it. Feedback from communities and the district health management team suggests that the emergency transport scheme is highly valued. Interestingly, the emergency transport riders have increased social status in their communities as well, who are recognised and appreciated. We have stories from Chama in the northeast of Zambia, where even though it's a non-monetary scheme and volunteers give up their own time and efforts, we saw during harvest that many other community members would, for example, go and cultivate the land of the volunteer riders as a sort of compensation for the time that they're giving up to help their communities. And again, these were things that the communities suggested to try and make the whole approach more sustainable. So we've just got a quote from one of the emergency transport scheme riders here on the right. Even if they come at 1 a.m., they will find the bicycle ambulance here. We saw the maternal danger signs, and we know that the bicycle ambulances have reduced maternal deaths. What motivates me is that I can reduce maternal deaths in my community. My next results slides, these are some of the figures emerging from the programme. Between September 2014 and June 2016, 3,649 pregnant women have benefited and used the ETS. 91% were for normal deliveries and 9% had a maternal complication. And this is really interesting. In a lot of other programs, we've had higher percentages that were actually for complications. But I think what we see here is that communities, rural communities, have a considerable reliance on the emergency transport scheme for emergencies and non-emergencies. And an emerging picture where actually the transport was also being used for ANC, for PNC, for vaccinations for children. So what started off as an intervention designed for emergencies has really evolved, and again, up to the community how they want to manage that. Okay, my slides have jumped. So we saw that women were able to rely on the emergency transport scheme 24/7, with 41% of the recorded transfers happening at night, which is also really important because even if the emergency transport might be there at a health facility, will it be available with somebody to operate the transport day and night? I just want to pick out another figure, which I think is particularly important. The percentage of women delivering at a health facility increased from 64% at baseline to 89% at endline. And I think that in just over 2 years, that's quite a striking difference, really. And it was a very robust endline survey and triangulated with Ministry of Health data, the HMIS as well. So we saw some really encouraging and positive response. That is not just because of the emergency transport scheme. It was also part of a whole community engagement and empowerment approach around the safe motherhood groups. But certainly the transport had a key part in achieving those results. This is a photograph of 2 mothers with their newborn babies. We also have a colleague, Kenny, from Disacare here, showing his product and meeting some of the community, which is also really important. The local artisans who are producing these bicycle ambulances, taking time for them to see their product in the community, to get that feedback. I think far too many programs do not share those learnings with actually the wider range of people involved. And so that was a really positive aspect as well. And then there's just a couple of quotes on the screen there as well. We don't have too much time, so I'll just move on to the next slide. Some of the key lessons learned. As Gina and Tony have already shared, community participation is vital. Speaking to the community, understanding what is likely to work, what will be sustainable, what are the cultural preferences or what are some of the barriers. In this case, an emergency transport scheme, but whatever transport intervention it might be, needs to be suitable for the terrain, culturally appropriate, and easy and available to maintain. We need to ensure that the spare parts are readily available, and this is also part of the ethos of trying to source and construct locally. We found that trying to link some of saving schemes or income-generating activities could also help finance repairs. I don't have time to get into the detail of that today, but that was an important part of the program as well. Also, working with oxen or any animal-pulled carts can be quite challenging. Sourcing and transporting oxen to interventional sites, providing vaccinations and ongoing care of livestock. So again, we work closely with the local vet's office there, so that when the programme is gone, there's also the communities are able to continue to work with the people who have the knowledge on the ground. And my last slide really on some policy implications then. Some of our key messages here is that the referral gap between the communities and facilities need to be addressed. We find that in the rural areas, and particularly here, we are focusing on access for maternal health services and for newborn children. The voice of the rural women and children particularly, it needs to be heard. We need to share these voices further. And the message that's coming out for us for Ministries of Health and governments is that specific budgeted activities need to be implemented. This needs to be acknowledged in the health policy and strategy. Normally transport is just dealt with otherwise up to district level and not beyond. Replacement costs for ETS vehicles should be considered in national or district health budgets. A focal point we also felt was needed within the Ministry of Health for all activities that help strengthen the community health system, including community-based emergency transport schemes, and the importance of avoiding procurement of inappropriate vehicles. Government departments and development partners should also use locally appropriate and evidence-based emergency transport solutions. So thank you very much for your time.
Thanks very much, Caroline. So to kick off the Q&A segment of today's webinar, I'd like to ask a question to each of our panelists. So Tony, I'd like to start with you, and I wondered if you could elaborate on how new technology, such as mobile technology, makes road and transport research more accessible and more participatory for local communities.
Okay, thank you, Helen. Well, the very fact that some people out there might be actually involved in this webinar on their mobiles shows how technology has enabled us to actually share information far more than we could in the past. And there are impacts, I think, in terms of research. First of all, one of the problems that researchers always have is getting data which is accurate, because clearly the quality of the data has a huge impact on the results of the research and on the interventions and solutions that might be derived from those results. So it seems to me that there are two aspects which I suspect there are lots of examples of how mobile phone technology can help benefit us. But I'm just going to talk about a couple which have occurred to me immediately. One of the things about research, as I say, is getting quality data from trials, for example, in engineering, demonstration and research projects. So very often what happens is the local research centre will send out a team on site, and they will conduct investigations, taking physical measurements on the road pavement. What very often happens, of course, is that inevitably some results throw up questions, and you get some anomalous results which from measurements which are made on site, and very often you don't know what the significance of these are. Are they just errors in the data, or are they true changes that are very often unexpected changes, because these are research trials after all. And very often you don't know these until the team gets back to the headquarters, and sometimes not even until it gets written up in reports, in which case it's too late to do anything about it. What has changed in terms of mobile phone technology is that you can have daily links with the technicians on site. So if there is an anomalous data thrown up, then you can ask immediately for additional measurements to be taken to actually confirm what is happening. That's just one from a research perspective. As for communities, of course, it also gives opportunities for much more active participation in the data that's being collected in surveys, for example. in my experience, people's recollection of how long journeys took or how distant they travelled are very unreliable. And of course, the longer between the event and the actual interview that's taking place, then the more unreliable these responses become. And I found this when I was doing roadside interviews even in the UK. So what mobile technology gives us is an opportunity to conduct these interviews remotely immediately after the activity has occurred. Now, given the best results are always going to be obtained from, in my view, from direct interviews. But of course, and there are serious constraints, as pointed out by GINA, in terms of dealing with children and people like me or the elderly, whose hearing might not be so good. But mobile phone technology does give us the opportunity to have more immediate contact with respondents. And there's a future exciting prospect as well, is that by combining phone technology and satellite technology as well, and GPS technology, that we can now track the movements of phones in a live situation, so that you can know very, very accurately, as it's actually happening, in cooperation with the local respondent, to actually, so that we can track the phone, so you can get exact information on how long has been taken in various modes of transport, how far people walked, how long they waited for public transport or whatever, and then how difficult it was, and you can get a far more accurate picture. So these are just a few examples, but mobile phone technology is clearly going to help us get more accurate data in the future.
Great, thanks very much, Tony. So now, Gina, I have a question for you, because you discussed many of the issues around engaging children in your presentation. So are there any specific issues associated with engaging women in communities?
Yes. It can be really difficult to reach women when you first start to work in communities. Over time, of course, you can build trust and you can begin to learn a great deal. But initially, very often in communities, well, women are busy. They've got children to look after, they've got a livelihood to make, they've got to collect water, firewood, and so on. So think about how you're going to be able to get information from them. And maybe you're going to have to go again. This is when walking with people is really useful, walking with women to find out some of those issues. You may, of course, also be in a cultural context where women are not expected to speak out at all, or maybe in seclusion. And again, then you need to think carefully about how you're going to get access to those women. And it may be, of course, that you need women researchers to go into the secluded compound or whatever. There's also just that issue of shyness that for a lot of women, they've not been asked. They will say, when we've talked with women, they say, you know, nobody's ever asked me about this before. Nobody has ever asked me about anything. And it is quite liberating to be asked and to be able to give to talk about your experiences. So that also can be very important. It's the whole thing of building trust so that women then feel able to talk. Of course, they may have had very little experience of using public transport or motor transport, and a lot of the experience will be about walking, maybe about waiting many hours though for transport. And it's taking the time to build up an understanding. Sometimes, of course, they have bad experiences that people have. They've they've been at meetings, big group meetings, where women have been asked to say what they think or what they need, what their experiences have been, and essentially nothing happens, nothing changes. So they begin to lose hope. So when you get research which moves forward, and there is action, of course, that's always going to help improve things for the future. And I think peer research is very useful if you're getting children talking to children, women talking to women, other women, and in a community, and building from there. Girls often are particularly difficult to reach, of course, because for young people are expected to be seen, not heard, and young girls especially. And again, working with peer research, we found really, really helpful in beginning to understand things like girls being harassed by taxi drivers, fear of biting dogs, that sort of thing. They wouldn't have told the external researchers who they see these as city people very often, although our work was in collaboration with local universities. It's very often, many years, even if they came from a rural area, that the university researcher has actually lived in a rural area, and rural women and girls may see them as very different and think that they just won't understand. So working from a peer research approach can really help move things forward. I think that's probably, well, can talk more if other people have got anything further to ask about that.
Thanks, Gina. It's very interesting. So, Caroline, our question for you is, how does TransAid see active action participation research?
Thanks very much, Anne. Well, I think I'll answer this in 4 parts, if that's okay, but be quite brief in my answers. I think the first one is it's vital. I think all this has really come out from all of the presentations. It's just vital to involve the communities, the people who use the transport, to determine the most appropriate and sustainable solutions, and to do this in a sort of a genuine way where you create the space to listen, have the humility to redesign your approach, have the confidence to go back to government partners or the donors and insist on this and insist on the reasons for the change, which I think we're not all often great at doing. So sort of resisting that pressure as well, even when programs are designed, and I'm talking specifically ones that are externally funded. Often we all know we have to create work plans, and these need to be costed as part of proposals for funding. We need to propose a set of indicators and targets for those. But I think it is really important to create this space in the design of such a program where we can genuinely incorporate the user perspective as part of that. And as part of doing the active action research, it's also, as Gina said, doing this in an appropriate way. For example, if we're designing an emergency transport scheme where the primary users and the target groups are pregnant women, we want to understand the travel patterns of women, the types of transport they're comfortable to use, that respond to their needs. And these may be very different than what somebody from the outside may think is important. And therefore, to do this with the correct approaches, so that, for example, we speak to women in women-only focus groups, where there may not be husbands or men there, or headmen in the village where people might not be comfortable to share their challenges, or why they delay, or why they don't travel to health facilities. So, for example, I mean, I focused today on Zambia, but in a program we're running in Adamawa State in northeast Nigeria, we worked with university students, and we worked with women who come from Adamawa, who live in Adamawa, and trained them to do the formative research to help design the emergency transport scheme there as well, because obviously women be much more comfortable opening up, and as Gina said, the importance really of building that trust so we can really understand what some of the issues are, not what we think the issues are. Also importantly, the way that we approach making sure we try and do this research up front, implement a program, and then really measure the change and involve the community in the measurement of that change. So, for example, in Zambia, we have a community monitoring system where the community members, it's only the minimum data set, so it's not too much of a burden, but so that on a monthly basis, there is some reporting that is done by the community, tracking a few of the indicators which they also help develop, most important to them. So, and what was really interesting about that is we found in the areas where we had the community monitoring system and where we had the emergency transport schemes, we saw much higher retention rates of the volunteers. And we do feel that this is also in part of actually having an active role for the community in the measurement, in the ongoing measurement and the final evaluation of this transport intervention. So the retention rates of volunteers after 2 years there was 95%, compared to some of the control districts, and that was very interesting. So instead of what could be perceived as an additional burden, actually we found that particularly a lot of the women that we were working with were, because they had the feedback about the change that they've made in the community and the difference, and because the time we've taken to share that and consolidate it, then that was actually very motivating and quite empowering as well. So I think that's something we also neglect to do often as development partners. And I very much like Gina's presentation of showing the presentation in Tanzania of the older people's research to the minister. I think that's so important as well, that we take these findings, that actually we can create platforms for the people who have been involved in such research to share it themselves with the minister or whoever it might be. So I think that is measuring the change as well, and disseminating it effectively is really critical.
Thanks, Caroline. That was a great and insightful response. So now I have a question open to all panelists. How do we take community-based research and translate that into information that is seen and heard by governments and donors? And I'm not sure who would like to begin. Caroline, perhaps you'd like to start with this question.
Yeah, sure. Thanks very much. I mean, first of all, I think it's essential that we do. I think that any of this research, and important, rich research that's being done, can be packaged in such a way that can be heard by governments and donors alike. Last Thursday in Zambia, we held a dissemination event where we invited government and a range of donors as well to share the experiences. And I think, those sort of workshops can be effective. What was great is we had some of the emergency transport scheme volunteer riders. One particularly active woman called Esther Piri, who's taken many women to health facilities. She stood up at the front of 150 people through the aid of a translator, and she told her story. And she explained what motivates her to do this for her community. She explained why she does this, how long she intends to continuing it for, and she answered questions from the group. So I think that these are some of the forums where it can be done, bringing the interesting voices and actually the voices from the people that know to just different forums. We need to make sure otherwise that things are packaged clearly, succinctly, that we produce evidence briefs or key messages for policymakers that are not too long and too wordy. We need, of course, we need the evidence and the data there, but we need to find ways to package this too for busy policymakers or busy managers, so we can share that around, and obviously through the internet as well. So, I mean, I think there are many ways that we need to share this information, but mostly importantly, make sure it goes to the right people, and so the action can be taken, so it's not just sitting there gathering dust. And I think we need to be quite innovative in the ways that we do that too.
Tony and Gina, it would be great to hear your thoughts on this as well. Tony, what's your response to this question?
Well, yes, I totally agree with what Caroline says, and it's been a constant battle. I mean, I've been in research for over 50 years, and getting research into practice has become a battle. Like I said in my presentation, I think it is becoming better, and the research centres that are being established, and some have been in operation in Africa for many years, of course, and elsewhere, but the new research centres being established give us an opportunity where things can happen which demonstrate the impacts that we're having, and whether it's the ambulances, as described by Caroline, or the other the transport services approach talked about by Gina. I think there is a change in attitude, and the research centres, as I say, certainly in engineering projects, allow us to actually demonstrate what can be done. And then the feedback from that is additional pressure on government to actually acknowledge that this can make an impact. And of course, if you get the local politicians involved, then they are very, very keen to actually show that improvements in their particular part of the country are giving benefits to local populations. It drives them; they're more likely to be elected, but they're also more likely to put pressure on governments to actually to show other regions that this is the way forward. So I think the research centres, in a way, are key to get research implemented. And of course, communities also. If you actually demonstrate to some villages what can be done, then word gets around quite quickly. And then such approaches are also then community-driven, because people say, well, you did this in the village down the road, why can't you do it for us? So I think things are changing, and it is becoming, hopefully, far easier to actually implement the results of research, and which has been a major challenge in the past. Thank you.
Gina, I also wanted to open that question up to you and to hear your insights into that.
Well, I think Caroline and Tony have more or less said it. I mean, I think I suppose a few little additions. I think the power of numbers still is really very considerable. That if you can show that something impacts on a lot of people, it does seem to help get things moving. And therefore, often community-based research is very localized, and it's scaling it up that's really key, which is why we use community-based research as a base then for building much larger research studies and big surveys, specifically with the hope that this will enable us to get attention from government and donors. I think another point, I suppose, is that in some areas we've got a lot of evidence, and the prime example would be gender. We know a lot about the issues that women face in rural communities across low-income countries, and yet it's very difficult to get any real change in policy and practice across the board. And of course that's why RECAP has got a currently commissioned research program where people are trying to find out where gender evidence has changed things and where it isn't, and how you can improve that process of moving from good research evidence to good policy and good practice. Thanks.
Thanks, Gina, and thanks to you all for contributing to that question. So we've been receiving a lot of questions from the audience. So I'll start with a question that we received about road funds, which have been increasing a great deal, but how do we make them incorporate basic access concepts? So an example is given, many projects are over-designed. So how do we incorporate specifically designed roads to meet local needs?
Is that one for me?
Absolutely, go ahead and respond to that, Tony.
Well, yes, it is a point, and I think the point I made also in my presentation is that we need local designs and specification to be focused on local needs, and certainly, you know, maybe engineers would perhaps not accept that roads are always over-designed. But certainly what we are doing and what has been the results of research been found from the results of research in recent years is that we can be more flexible, we can make more use of the local materials, and we can have designs more appropriate for the function of local roads, so that we can make the case for providing improved access for rural communities by implementing the research. And as I know I'm repeating myself, but the fact that we can put these results of research much more easily into revised documentation and update documentation because it's now in digitized format, we can update it more frequently, then this is likely to have a big impact on more appropriate designs and more appropriate use of local materials. Thanks.
Thank you. We also just received a question about political will, which I believe this has been touched on already, but how important would you say research is compared to missing political commitment to adequately maintain the existing road network? And I wonder if, GINA, you'd like to begin with that question.
Sorry, can you just repeat that?
Yes, of course. So how important is research compared to missing political commitment to adequately maintain the existing road network?
Political will is crucial, but I suppose the key thing is to get politicians to appreciate the research findings that are available, and to encourage them to use that data to help shape interventions. I suppose the difficulty is that for politicians, very often, they need to be seen to be doing things which improve life for their political constituency. And it's only often with very immediate interventions that immediately impact on that particular community that things will go forward. I think it is really difficult because the argument that's made so often is that you can have all this evidence, but politicians are dealing with immediate issues, and it's at whatever fits as a reasonably easy, cheap, immediate response, the best impact for minimum effort, you could say. That's a very cynical view, I suppose, but it is one that's got a lot of currency. Thanks.
Thanks. So another question that's come in is, what types of tools do we have for life cycle costing? So thinking through all phases of funding of rural roads. Caroline, would you like to answer this one?
Oh, I think that might need an engineer. I presume that's looking at the life cycle of the roads. So probably Tony is better placed. We're working more on the transport services, not the infrastructure side, if I've understood the question correctly.
That's absolutely fine. Tony, would you like me to repeat the question?
No, I think I got the question. Well, there are tools being developed. Of course, for higher order roads, there are tools, as I'm sure the questioner is aware, like the Highway Design and Maintenance Model, HDM, developed initially by the World Bank, but that's mainly for higher order roads. But there have been results. I got a feeling the TRL produced a simple spreadsheet which enabled you to actually make a rough calculation on the likely life cycle costs. Because things are changing. You know what's happening in some countries. I think Kenya is one. The good gravel is being depleted quite rapidly. So what happens is you tend to use poorer gravel, and then obviously the road deteriorates more quickly. So the cycle of deterioration and maintenance is becoming ever more frequent. So the need for maintenance is becoming ever more frequent, and that really raises costs. And this is why, in terms of low-cost servicings and so on, developed through research, it's becoming increasingly cost-effective in economic terms to seal roads at much lower traffic threshold. So, you know, these are some ways in which it can be improved. And like I said, I have a feeling in one research report, I've seen a simple spreadsheet being developed to enable you to get a handle on life cycle costs. Thank you.
Thanks very much. So I think we've got time for one more question. And one that's just come in is, what is the difference between community engagement and participation? Caroline, would you like to begin with this one?
Yeah, sure. Thanks, Helen. I just saw that question coming in, and it's a good one. I mean, there's a lot of words we're using here: participation, engagement, empowerment. I think, you know, for me, and this is just my personal response, I think, you know, the participation of the user perspectives in any research is absolutely vital, and I think that's where we're talking really about the sort of participatory methods, actually, you know, speaking to the community, speaking to the users, and doing that in appropriate ways. From the practitioner perspective, we're probably talking a bit more using language such as community engagement and community empowerment in the types of approaches that are put in place, so that in the implementing or the intervention activities to ensure that they are owned by the community, that there is the engagement there, and after all, that the approach is empowering and it's in design. So that's how I would sort of assess the different nuances from the practitioner perspective.
Thanks. We've actually had another question come in for you, Caroline. Was there room to consider motorbikes as an alternative in the case study that you discussed in your presentation? So as an alternative, not a replacement for the bicycle ambulances, now that motorbikes are ubiquitous.
Sure, and I've tried to respond to that, typing away frantically as well. Yes, absolutely. Actually, More Mamas was phase 2, and during Mamas, the first program, we did also trial some boats and some motorcycle ambulance as well, using a sidecar. In the very remote, deep and rural parts of Zambia where we are working, we actually found it, and sadly, because I'm a big champion of using the motorcycle for rural access, but sadly in the particular areas we were working, we found that the running costs, the fuel and the maintenance were a real challenge for the communities to manage themselves, or for the district health management teams to carve out that budget. So that was something we did struggle with, and we actually saw higher levels of utilisation for the intermediate modes of transport that were based at the communities. So that's why in the More Mamas program we actually focused on the ox carts and the bicycle ambulances. We are, you know, operating in very sort of rural Zambia. However, I think absolutely motorcycles are really, you know, growing and have fully emerged as a really important way for people to access health services, education, livelihoods, particularly in rural Africa where most of our work is, for example. So in Uganda, in Nigeria, we're very much using that approach and working with the motorcycle taxis and the boda bodas and the unions. So I think the point to that is we started by looking at what was there and talking to communities about what transport exists and what's available day and night. And if there were motorcycles operating in the areas where we're working, you're quite right, they are starting to emerge, but not full penetration in rural Zambia in all parts yet at the moment. But give it a few years and they'll be there, I'm sure.
Thanks, Caroline. We've also received a question for Tony. Do you not think that the establishment and sustenance, at least in the medium term, so plus or minus 10 years, of regional road research centres is the key to engendering local involvement in and ownership of research outputs? So those are likely to lead to more cost-effective and sustainable development of rural road infrastructure and transport services.
Thank you. Well, I was just starting to read to type a response to Mike. Yes, indeed, and I think there is a big difference in the performance of road research centres in the past. I mean, you don't necessarily need an old road research centre, but you need something within government that actually sustains research. That's the important thing. It could be a research centre, preferably, but it could be just a group or component of the existing structure. Certainly, in terms of embryonic research centres, it is very, very important to give support, and that's been done under the RECAP programme. And also that existing centres, which for some reasons haven't developed as they should have done, and clearly support is important for these too, because in terms of sustainability, unless they are shown to be productive, then they won't get future funding. And what we want to avoid is a cycle of poor performance, less funding, poor performance, less funding, where in the past research centres have disappeared because they haven't been effective. So I think it is important that we give research centres support until they get to a point where they are fully independent and fully functionable. Thank you.
Thanks to all of you for all those responses. It was very insightful. And perhaps we could just have one quick round of kind of last words. We have a couple of minutes left, and I'd like to hand it over to all three of you, to Caroline, Gina, and Tony, for maybe your key call to action for the development community. So just kind of keeping it brief, in a nutshell, what's your call to action? What's your message that you'd like to be the takeaway of this session? Gina, would you like to start with this?
Okay, thanks. I think above all, think carefully, plan carefully before you start to intervene anywhere, so that you really have understood local context. Local context is absolutely crucial. Thanks.
And Caroline?
I mean, I think Gina summarised it perfectly. Yes, really understand the issues. Make sure you do the local context. Listen to the people who are best placed, and gather the evidence. And Gina's quite right with getting the data, getting the evidence. That's the way that we're going to be able to really see the change and scale up and get people to take this research seriously as well, to see that it is robust, to value both quantitative and qualitative research, and to try and get the governments, the policy makers to make the change.
Thank you. And finally, Tony, your key call to action.
Well, I certainly endorse everything that Caroline and Gina has said. Certainly, the key thing is support research, do what we can to get research undertaken, because it does pay. Sometimes it takes some time for it to go to get the research completed and implemented, which is very often the difficult stage, but it's worthwhile in the end, and there are plenty of examples internationally to show that it does.
Thanks. That's great. So thank you all so much. But I'm afraid we've come to the end of our scheduled time for this webinar. But thank you for joining us today, and we really hope that you enjoyed the conversation. There was a lot of activity on Twitter during the discussion, so be sure to follow and join the conversation using the hashtag #DevWebinar. And if we weren't able to answer your question today, please do feel free to submit them by email to webinars@devex.com, and we'll do our best to have your questions answered. And if you want to watch the webinar again, we'll be emailing it to you next week and posting it on devex.com. So look out for that in the near future. There will also be a survey for our audience immediately after the webinar finishes. So keep a lookout for that. And again, I'd like to thank our presenters for taking the time to speak with us today. On behalf of DevEx, I'd like to thank you all for joining us. And I hope you'll join us for our next online event. Thank you.